Assalamu alaikum and welcome to IQRA TV. You're watching Medicour for the next hour and I'm your host Rabina Mir. Today's topic is very much around that very important organ in your body called the heart. So we want to make sure that we not only understand a little bit about how it works but how we need to look after it. So in the hot seat today I'm happy to welcome Dr. Liz again. Hello Liz, welcome to the show. So lots of people we're hearing about in the community are struggling and suffering with heart problems. What's going on?
Right, major topic. About 520 people today will have a heart attack.
Today?
Today,
That's
in one day, 520. And very sadly, about 190 of those people will die of their heart attacks.
That's quite shocking.
So not everybody dies of a heart attack, but a substantial number of people. So I think what I want to do is to explain about heart problems, but I want to start from quite a basic level so that everybody understands just what's going on. So I'd like to introduce by having picture number 1 and basically showing where the heart is.
Okay.
Now I think most of us are actually aware of if we run fast, if we're very excited, we can actually feel our heart beating, and so it's just behind our breastbone towards the left side of our chest.
Yep, I can see it.
Now, what I want you to imagine is that the heart is like a pump, and it's pumping blood round our body. Rather like at home, your central heating system has a boiler with a pump in it that's pumping water round your house.
Okay, that makes sense.
Taking the pipes through into your kitchen, into your bedroom, into your dining room. So as long as the pump is working properly, then the pipes are taking the water round. However, if there's a problem with the pump, then the central heating system falls to bits. So in a way, we've got a very similar process going on. The heart's a pump. It's pumping blood around our body through the arteries and the veins.
Okay.
So I'd now like to show you what a healthy artery will look like.
Okay.
So we should have a photograph coming up of a healthy artery. So think of that artery as like a pipe, and we're looking down the pipe.
All right.
So that's a nice, clean, open pipe. The problem is if we start to have a narrowing or a part blockage in the pipe. So could we go on to the next photograph? And there are 2 pipes on this picture, and one of those pipes will be a nice, wide, open pipe.
Yes, I can see that.
But if you look at the other pipe, what you can see is it's partly blocked. There's a sort of yellowy blob.
So what's that?
That yellow blob is basically cholesterol. And cholesterol is a fat, and we can definitely talk a bit about cholesterol in a minute, is a fat which is going through our blood and starting to stick to the sides of the pipes and gradually builds up and can cause a narrowing of the pipe. Now, this is just a very simple drawing. I'm going to show you now, Rabina, what a real artery which is partly filled with cholesterol or fat looks like.
Okay.
So if we could have our next photograph, and it's not a pretty sight. So can you see there, instead of a nice wide open tube, it's partly blocked by that yellowy, shiny glob. So that yellowy bit is actually cholesterol, and it's blocking or partly blocking. We can only see a narrower opening for the blood to get through.
Okay.
And the worst thing that can happen is, could we go on to the next photograph please, is this is another artery which has got a lot of cholesterol in it, and the next picture please is actually showing where that yellowy, we call it atheroma or cholesterol, is now the space in between has become blocked because the blood has actually clotted in there, and that's what would effectively be happening if you were having a heart attack.
Because no blood's going through, is it?
No blood is going through. It is completely blocked.
Yes, that does sound really serious then.
Exactly.
Okay, so that makes sense now that we can't get the blood through, the heart can't function properly, so something's going to go wrong.
Exactly.
So is this a heart attack or are we talking about angina?
Right, good point there. I want to make it very clear the difference between angina and a heart attack. Now, in angina, we have a partial blockage, but not a complete blockage. So some blood is getting through. So the heart is getting some blood, but because the artery is narrowed or partly blocked, it's not getting as much blood as it really wants.
Okay.
And the heart is really like a big chunky muscle working, pumping away. And if it's not getting enough blood, then that heart muscle is going to struggle.
Is that where the pain comes from then?
That's exactly right. So, for instance, you know how you get a stitch if you run a long way? It can really be uncomfortably sore. Well, when you have angina, what's happening is the muscle of the heart is not getting a good enough supply of blood, and so that pain is actually pain coming from the heart.
Right.
And the typical angina pain will actually be, if you think back to the picture of where the heart was, in that area, round behind our breastbone, the left side of our chest, but it can also pass down the arm, and it can, for some people, pass up into the jaw.
Okay.
So this is a pain which will most likely come when the heart is having to work hard.
So the more it's spreading, the more there's a problem.
Exactly. So, for instance, if you were to run upstairs or carry heavy bags or decide to dig your garden, do something very strenuous that meant the heart had to work harder, that's when it needs plenty of blood, but it's not getting that supply of blood. So that's when angina comes. So the person could have some angina, could then stop digging the garden, stop running up the stairs, put the bags down, and then the heart has chance for the blood supply to continue, but it's now enough because the heart's not under strain, so the pain eases off. So that's angina. It's a pain coming from the heart when the heart is having to work hard.
So if somebody's having symptoms like that, it sounds to me like, would they necessarily know it's straight away that they should see a doctor, or do you think people might not recognise the importance of that?
People might not realise what that pain was, but now hopefully because they've understood what we're saying, they will understand possibly that does need following up. Now, lots of things can cause pain in your chest, so let's not presume any pain in your chest. You could pull a muscle, you could lift something in a funny way and pull the muscle. But if you start to get a pain which is always related to exertion, which is in that area, do you remember, up into your jaw or down into your arm, certainly that is something you should go and talk about with the doctor, with the practice nurse, with the nurse practitioner. Definitely go and have it followed up.
That's really useful to know.
So that's angina. So what is a heart attack? Well, do you remember I said that the heart is really a big muscle capable of pumping the blood round our body? Well, do you remember the picture where the artery was completely blocked?
So nothing's getting through.
So nothing's getting through. So the muscle is getting no supply of blood at all. So that it's not getting any oxygen, it's not getting any glucose, so it can't work. So what happens is the heart muscle will actually die. So that area of heart muscle can no longer work, and that will cause a really bad pain.
So is that pain going to make you unconscious, or could you be conscious while that's happening?
You could be conscious, but you could also lose consciousness, because let's think, if your heart's not working, it's not pumping blood up into your brain, it's not working properly, people could lose consciousness. And I think we've got a photograph now of somebody typically having a pain in his chest. Perhaps we could go on to the next. There we are.
There we go.
There's somebody, can you see, is holding on to that area that we've identified as being exactly the area where you can have chest pain. So think angina, think heart attack.
So if you're on your own, because sometimes people don't have people around them to call for help, what could you do for yourself?
999. Sit down, shout for help, 999.
That's the time.
Now, if somebody has angina and they know they have angina, then very often they will have tablets which particularly go under the tongue, or a spray, and they can use the spray or the tablets to ease the pain.
So those just pain relief medications?
No, what they're doing is there's a special ingredient in the spray or the tablets which actually opens up the artery going to the heart. So instead of it being rather narrow, it will actually open the artery up so more blood is going to get through.
So it's a quick fix, but it's not a fix?
Absolutely.
Okay.
And if the angina gets better having used a spray, and then it comes back again, and the person finds they're needing to be using more and more spray, that is a medical emergency, and that again could be a sign that a heart attack is going to follow and should be followed up by going and ringing 999.
I mean, I would imagine that there is that level of pain where you know you need to ask for help, or you need to be seen. So,
but it's interesting you say that, because some people have what we call a silent heart attack.
okay.
So it may be at a later stage they go and they have a heart tracing, one of those tests, and that can actually show that in the past somebody's had a heart attack, but they haven't realised it. Maybe they put it down to a bit of indigestion.
Yeah.
Maybe they just thought, oh, I shouldn't have eaten so much tea. Maybe they thought, oh, I've eaten too much spicy food. And they didn't realise that actually there was more to it than that.
Okay.
And it's interesting as well that although we tend to think that men and women have very similar problems, more ladies can actually have what we might call a silent heart attack than blokes.
So maybe when it comes for our tips today, we can think about what women and men might need to do differently, or do you think they still have to do the same thing?
I think they still have to do the same thing. They still have to be aware of what could be going on.
Okay. Earlier you were talking about cholesterol, so I want to take us back to cholesterol. I've heard of good and bad cholesterol. What are we talking about here?
You're absolutely right. When we have a blood test, we can measure the total amount of cholesterol in our blood, and then we can divide that into good cholesterol and bad cholesterol. Good cholesterol is when the cholesterol is holding hands with another protein in our blood, and that protein is taking the cholesterol from our blood and taking it back into the liver, so it's getting rid of the fat in the blood, so therefore it can't start sticking to the arteries and blocking them.
Okay, so the bad cholesterol sticks, but the good cholesterol doesn't?
Well, no, the bad cholesterol is moving towards the blood vessel and wanting to stick. So good cholesterol is coming out of the blood, going to the liver, and bad cholesterol is going into the arteries and may stick.
Right.
So, and then the next thing to think about is, right, what can I do to prevent too much cholesterol being in my blood? And this is where the diets that we eat are very important. You've probably heard of talking about saturated fats and non-saturated fats. And saturated fats are the bad fats. Those are the ones like butter, I'll say this right, ghee.
Ghee, yep. That's your clarified butter,
and thinking about things like coconut oil.
Now that's an interesting one, because I've had a question from Fozia in the community asking me. I think she's been told she was borderline high with her cholesterol, and was given a list by the GP of good and bad foods to be aware of, and she was surprised to find that coconut oil was in the bad category, when actually there's a lot of information out there saying that it's actually better for us.
Well, there's been a bit of a thing in the papers and on the news press, which is almost implying to me that coconut oil is better than, or I should say is not as bad as things like butter, whereas actually it's very, very similar. So if we want to talk about good fats, we should be thinking not about butter and coconut oil, we should be thinking about rapeseed oil, sunflower oil, olive oil. We should be thinking about particularly, I don't know if you've heard of fats called omega-3, omega-6?
They come from things like oily fish, don't they?
Absolutely right, oily fish. So thinking about salmon, thinking about mackerel.
Tuna?
Tuna, yep, all those things. Walnuts.
Okay.
So those are the healthy fats. So we should be not trying to eat too many pies, too many cakes, biscuits, which often have butter in them. We should be thinking not so much about putting butter on our bread, trying to avoid. Now, I am not saying we can never have butter, we can never have coconut oil. I'm just saying we should be using sensible amounts.
So is this about calorie counting, or is it something more than that?
Well, it's both really, because
Okay.
the thing is, we get a lot of energy from fat, but the trouble is that we tend to put weight on when we eat too much fat.
So it's portion control.
Portion control and thinking of alternatives.
Because I think many of us have gone back to butter because we're hearing bad things about margarines.
Well, I think a lot of the cheaper margarines have a lot of trans fats in them, and
Okay.
trans fats are very bad. These are where chemical processes have gone on with vegetable oils,
Okay.
often in processed foods, that sort of thing. And those are definitely fats we should be avoiding. So a good diet can include some butter, can include some coconut oil, but should be more towards the rapeseed, the grapeseed, the sunflower, all those sorts of things.
When I'm thinking about coconut oil and I'm thinking about butter compared to the oils that you're talking about, they're the solid fats at room temperature. Is that one of the ways to think about this, or
No,
does it make a difference?
I think we just have to think that that doesn't necessarily follow,
Okay.
because I've just told you that the trans fats in some of the cheaper margarines, which of course is solid,
Yes.
are very bad. So no, I don't think we can just say if it's a liquid it's okay, and if it's solid it's not.
Okay. All right. So we just need to know a bit more about the quality of the foods that we're using,
Yeah.
and making sure that we just limit how much we're using.
Yeah,
I guess that's with all fats then.
yeah.
Okay. Which foods then contain the good fats and the good cholesterol, and which foods don't?
Well, do you remember we just said that it's things like rapeseed oil, the
Yep.
sunflower oil, it's things like the oily fish, but not just thinking about fat, thinking about our diets in general, having more whole grains, so the brown breads, the brown rice, having using more fruit, more vegetable, having a balanced diet, not too much red meat, going a bit more towards the chicken, thinking about those, but a mixture of
fish.
everything.
Yeah.
Fish, definitely.
I mean, I wonder about the rice issue, because rice is a big staple part of our diets in the Asian community, and many of us use basmati rice rather than your generic white rices, but brown rice is not a common feature, and we certainly don't make, even though our pilau looks brown, we've fried the onions to make the
Well, you're
to make them brown.
absolutely right. White rice has a huge amount of sugar in that when we eat it and digest it, there's a lot of sugar coming out of it.
Because I'm under the impression that basmati rice has a lower GI than the generic white rice, so is it still good enough?
Oh, given a choice of white rice or the whole grain, the brown rice,
Yeah.
definitely go for brown rice every time. Do you know what I think? What you need is to get a really good dietitian to come and have a chat,
think we do,
so that
yeah.
we really understand exactly what are the best choices to make.
Well, I'll certainly work on that
Yeah,
one.
I think that's worth thinking about, because I think
I
could
can't see our
certainly earn a lot.
community really moving to make pilaus and their rice from brown rice, and I really want to understand a bit more about whether we're doing too much harm with the basmati rice, when actually I agree with you about the portion control and the fact that the links with diabetes and the sugars and things, but I guess it's about, if it's a traditional way of cooking that is really hard to change, then what can we encourage people to do
Well,
about that?
Let's get an expert to talk to us, and if we understand what's going on, then we can make a proper choice, can't we?
Yeah.
We know what we're choosing.
Yeah.
And again, we're not saying you can never ever have a certain
No.
favourite,
Yeah.
but maybe we're just explaining, here we go again, portion control,
Yeah.
but also seeing are there alternatives, which after a while we might like just as much as we, I always used to drink whole fat milk. I was brought up on whole fat milk. Gradually over the years, I went to semi-skimmed milk, thinking of the fat content. Then I'm now on skimmed milk, and I now find full fat milk sickly.
Yeah.
And it's amazing how your palate does change over time. So first of all, you might think, oh, I don't like this. Yeah. But it's amazing if you persevere, when at the end of the day, you're thinking about your overall general health.
I'm smiling a little bit because I totally recognise where you're coming from on this, but I also recognise how many of us are preparing food not just for ourselves but larger families. And
but hang on a minute, why don't you want the whole of your family to be healthy?
Oh, I don't think it's you don't want them to take it on board. It's a case of when you've got older generation or people that are set in their ways, they're not always open to that. And I think that is one of the challenges as being particularly a South Asian mum, how those things do challenge us. But I also recognise that, like you're saying, with butter and things that are not particularly good for you, you don't have to have them all the time, do you? So if we didn't eat them all the time, but there were special occasions or occasional treats, then I guess that's the other way around if we're not going to change those habits. I absolutely get where you're coming from with that. Thank you. Okay, what was the next question I had for you was very much around going back to the heart health and the conditions of angina and heart attacks. I've also heard people have procedures done called stents and bypasses, another thing we hear.
Okay.
What are they about?
Right. Do you remember we said the basic difference between angina and a heart attack was that in angina there's a partial obstruction or a partial blockage, whereas in a heart attack we've got a complete blockage.
Yes.
So if it's known that somebody has angina, they've had investigations, special tests can actually show that there is a partial blockage in the artery to the heart, then a stent procedure is where a stent can be put in and that blockage can be opened up. So, as it were, we are pushing towards where the blockage is and then we're opening it up so that we've now got a full pathway going through.
So it's like a hose pipe having something pushed through it to open up where it's clogged.
Yeah.
Okay, so how are you getting to it? Because it sounds like you're going in through the chest.
Yes.
You are?
Or sometimes it can be through the groin.
Yeah.
So depends on the person. I think groins are quite commonly used as well.
Okay.
But every person is an individual.
Yeah.
Now, if we talk about a bypass procedure, that's somebody who's usually had a heart attack or certainly one of the arteries to the heart is completely blocked. So let's imagine you're on the M1 driving down to London.
A very busy motorway.
Busy motorway, and there's a big accident and the motorway is completely blocked. But you absolutely have to get to London.
Yep.
So what you'll do, you'll come off at a little side road and you will bypass that blockage and then you'll come on the little side road back onto the M1 so you can get back on and carry on down to London.
Right.
And in a way, a bypass procedure on somebody's heart is exactly the same thing.
Okay.
What they will do is they will usually take a vein out of somebody's leg and they will use that as literally a pipe which they can sew round to completely bypass where the artery is blocked.
Okay.
So that's the difference between a stent. Stents can be used for people who've had heart attacks as well, but depending on the degree of the blockage, a stent or a bypass.
Okay, that's really useful. I can actually visualise that when you talked about the motorways.
The M1, yes.
Yeah, absolutely. Yeah. Okay, and we also hear about things like beta blockers and ACE inhibitors. Is that part of the medication that people have?
I think what we're starting to do now is we're starting to talk about the treatment for people who've got heart problems. So we will talk about the tablets, but I want to also talk a bit about lifestyle and other things as well.
We might have to come back to that after the break just because it's almost break time. So medication is one of the things we can talk about next, hopefully. And then hopefully we can also think about what are the other things that we can do to make sure that we don't get into this situation in the first place. So we've talked about people that are already at risk of that, but then what about those of us that want to prevent that happening? Yeah. Hopefully after the break we could talk about that.
Prevention's always better than cure.
Okay.
Yeah.
So thank you very much, Liz. We'll come back to you after the break. So inshallah we'll see you after the break where we'll be exploring this even more. Assalamu alaikum.